Good evening. My name is Danielle Joyner, and today I'm going to present to you a tentative EHR plan for Better Care Hospital Center. We at Better Care Hospital Center believe that servicing our patients with the best quality is the most important aspect of healthcare. We strive to accomplish this by implementing an electronic health record system to make the structure of receiving medical services at Better Care an easier process. Better Care Hospital Center is a medical institution dedicated to providing quality patient care for the community to promote the very best health care for those we serve. We endeavor to fulfill this mission by putting into practice the tools and resources that will give our patients the very best experience when they enter our hospital center. We know that wait times and paperwork can be very stressful for our patients, and therefore, keeping our mission in mind, we believe that EHR implementation plan is the best method to decrease unnecessary stress by alleviating the issues above. The purpose of the Better Cares EHR plan is to provide better quality, reduce medical errors, decrease patient wait times, and provide an overall good patient experience. In order to make this plan successful, we produce a few goals that will help for a smoother transition of moving from paper to a computerized system base. The goals that we have set for Better Care's EHR plan are as follows. The process will be worked on 5 days a week. It will take approximately 282 days with a completion goal of 13 months. Before starting the work for our EHR system, we came up with the key tasks that will need to be completed in the following chronological order: patient information management, laboratory, pharmacy, radiology, imaging, and clinical information system. This slide shows the tasks for the EHR implementation plan listed in sequential order according to the priority. We listed what we considered the high-level tasks first because we thought that subordinate tasks could not be completed unless they were in a specific order. For example, the EHR begins with the Patient Information Management System. Registration, admission, discharges, and transfers are centrally managed and utilized first in an EHR system because it is the master enterprise for the entire system and essentially is the basis of any EHR. Clinical information would come second because a clinician can only connect this type of information to patients that are already listed in the system. For instance, the EHR system houses clinical information to enable medical staff to accurately and efficiently capture clinical encounters. Providers are able to enter, review, and update information connected with any patient, which include ordering lab tests, medications, diets, radiology tests, consults, and procedures. This slide is an example of how the entire EHR system should be set up. Listed in this slide are subtasks that will assist in the organization of the implementation plan for Better Care's EHR system. Just as the previous slide for the tasks, we at Better Care felt that the subtasks also needed to be in a specific order that would support the system to flow more efficiently. This slide shows the subtasks listed under the tasks according to their importance. For example, under the task for Patient Information Management, I have listed the subtasks in the following order: Enterprise Master Patient Index, Patient Registration, Admission, Discharge, and Transfer, and Patient Scheduling. This slide demonstrates the dependencies and the subtasks for the EHR. The arrows colored in blue are informing us that certain subtasks cannot be started unless the preceding subtasks are completed. For example, under the task for Patient Information Management, Enterprise Master Patient Index is a has a configuration process that lasts 3 days. Thus, patient registration cannot start until this development is complete. For instance, we would not be able to add patient information into the system unless there is a master patient index that manages the registration, admission, discharges, and transfers for the patient. This index needs to be the start of any EHR before patient information can be entered. This slide illustrates the control system for checking and adjusting the project plan. Tasks that are completed ahead of schedule can be entered into the task information section. When you double-click on a particular task, a box will pop up, and you'll be able to insert what percentage of the task is completed and change the start and finish dates. The only consequence to completing a task earlier than the scheduled date is that this will change the start date of the subsequent tasks that follow, and ultimately alter the entire plan. The key elements that I took away from this project involve Microsoft Office, managing system, and project management. I have learned a great deal about how to set up a system and manage a project for implementation from start to finish. Microsoft Office project is a fantastic tool to help facilitate the structure of a developing idea. Additionally, it gives the person the capability of controlling the project work. I believe completing an EHR plan would have been more difficult without this device, which proves to me how important modern technology is to healthcare and systems like EHRs.